So now I'll be explaining about regarding anti-diabetics drugs. So the first class of drugs which I'll be discussing happens to be called as your sulfonylureas. Sulfonylureas. This is one of the drug which is, yes, it is commonly used in clinical practice. Of course, the first drug which has been given to any diabetic happens to be metformin. And of course, if the patient has not been controlled, if there's no glycemic control with metformin, you go with a drug called as, a class of drugs called as sulfonylureas. It has first generation as well as second generation. First generation and second generation. Clinically, second generation is used. First generation is discontinued now. So the first generation includes your tolbutamide as well as chlorpropamide. So one of the question which has been repeatedly asked in your INI set as well as NEET exam happens to be side effect of chlorpropamide. The side effect being SIADH. Of course, there are many drugs which cause SIADH as side effect, but from this anti-diabetic perspective of view, this is one of the drugs which causes SIADH. Now coming to second generation, these are drugs which have been commonly used now, which includes glimepiride. It includes glibenclamide. Glipizide. One important feature is glipizide happens to be short acting. It's short acting. Since it is short acting, it has less chance of your hypoglycemia. So let me summarize this part. So sulfonylureas, it has your first generation as well as your second generation. First generation is not used now. Second generation is commonly used in clinical practice. The first generation includes tolbutamide as well as chlorpropamide. One of the repeatedly asked question being SIADH being the side effect of chlorpropamide. Extremely important to remember. And then you have the second generation which includes glimepiride, glibenclamide, glipizide. And one of the special feature of glipizide being it is short acting. Hence it has lesser chance of causing you hypoglycemia. Then we move on to the mechanism of action. This is one of the anti-diabetic drug which causes the release of insulin. There is metformin which causes your euglycemia. It does not cause the release of insulin. It decreases your insulin resistance. So you have sulfonylureas being a drug which causes your insulin release. So how does it do? There is a mechanism of action for that. This drug basically acts on beta cells of pancreas. This beta cells of pancreas, they have a receptor called as your sulfonylurea receptor, SUR1 receptor. So very simple, it acts on beta cells of pancreas which contain a receptor called as your SUR1 receptor or also called as sulfonylurea receptor. So what does it do? This drug basically goes and binds to the receptor. This receptor is an ATP sensitive potassium channel. It is an ATP sensitive potassium channel. Since it is an ATP sensitive potassium channel and when the drug basically binds to this receptor, it inhibits the outward movement of potassium. So the drug binds to the receptor, there is inhibition of outward movement of potassium. When there is inhibition of outward movement of potassium, it obviously causes your depolarization of cell. Due to this depolarization, there is release of calcium, release of intracellular calcium. Okay, there is release of intracellular calcium. This intracellular calcium, it promotes the fusion of insulin containing granules. This is your insulin containing granules with the plasma membrane. So let me repeat it again. So the drug basically acts on beta cells of pancreas. This beta cells of pancreas basically contain a receptor called as a sulfonylurea receptor, SUR1 receptor. This receptor is your ATP sensitive potassium channel. So when the drug binds to the receptor, it inhibits the outward movement of potassium. Extremely important. Since it inhibits the outward movement of potassium, it causes your depolarization of the cell. Since it causes depolarization, it triggers the release of intracellular calcium, which in turn promote the fusion of insulin with plasma membrane and cause release of insulin. Very simple. And of course, after the insulin has been released, it brings your blood glucose level down. That's how it works. So let me summarize it again. There's first generation, second generation. First generation is not used now. Propamide is one of the drugs which causes your SIADH, and then there's second generation, which includes glimepiride, glipizide, as well as glipizide. So mechanism action, it acts on beta cells of pancreas, which contain a receptor, which is ATP sensitive potassium channel. After acting on it, it basically causes your insulin release and decreases your glucose. That's how it acts. It's quite simple. Even this is helpful even from an entrance perspective. Then of course, the most important thing after mechanism of action includes your side effects. What are side effects of sulfonylureas? There are many side effects, but things which are important clinically as well as from entrance perspective is the few things. So first being your hypoglycemia. Of course, antidiabetics do cause hypoglycemia, but we'll come to a special feature of metformin later, which does not cause hypoglycemia. Metformin causes euglycemia, not hypoglycemia. But here we'll focus on this. So sulfonylureas are known to cause your hypoglycemia. That's one of the side effects. And yeah, the most important thing is weight gain. Weight gain is one of the side effects. Why? Because when an obese patient has come to you and he or she is diabetic, it's not prudent for you to start sulfonylurea because they're already obese. Why do you want the patient to gain more weight? Of course, you start with metformin, but knowledge about weight gain in antidiabetics is extremely important from clinical perspective of view. So one of the side effects is weight gain. It causes 1 to 3 kgs of weight gain after starting sulfonylurea, mainly due to the insulin action, excess amount of insulin released. Okay, so hypoglycemia, weight gain, and it does cause your hypersensitivity reactions. And then the other important side effect happens to be your disulfiram-like reaction, of course, when taken with alcohol. So these are the important side effects which have been noted. Of course, these are this explanation is more from the entrance perspective more than your theory or university exam perspective of view. It's more through entrance angle I have given this explanation. So they have asked questions regarding SIADH as a side effect. Yes, they have asked, and they can frame questions regarding your hypoglycemia. Sulfonylureas cause hypoglycemia, whereas metformin causes your euglycemia. It does not cause hypoglycemia. And of course, knowing mechanism of action is at most important for any antidiabetic or any drug for that matter. You can gain a perspective of what is into it. Then there's another class of drugs along with sulfonylureas which are very closely related. These are called as your meglitinide analogs. So they are very closely related to sulfonylurea because they have the same mechanism of action. So drugs include repaglinide as well as something called as nataglinide. So the main difference between sulfonylureas as well as meglitinide analogs include they have a shorter, they're basically shorter acting. Since they're shorter acting, they have less chance of hypoglycemia. So this is all about sulfonylureas as well as meglitinide analogs. In the next part, I'll be discussing one of the most important drugs with respect to antidiabetics, that is metformin, which is being commonly used. Thank you.